Oklahoma Republicans love to talk about rural values. But rural values are not protected by speeches. They are protected by whether families can get to care in time. Oklahoma identifies 59 of its 77 counties as rural. Nearly 4 in 10 Oklahomans live in rural communities. A state like that cannot treat rural health care as a leftover item in the budget. Rural Oklahomans travel an average of 80 minutes for comprehensive trauma care. Only 13% live within 30 miles of a trauma center. An 80-minute drive is a long time to a ball game. It is a lifetime if you are bleeding. Rural Oklahoma has far fewer primary care doctors than the national average. The gaps are even worse for OB/GYNs, psychiatrists, and child psychologists. Those are not just workforce numbers. They are the odds of family faces when something goes wrong. Oklahoma ranks near the bottom nationally in overall health. Rural Oklahoma has higher rates of obesity, diabetes, heart disease, and suicide. That means rural families face more health risk while the care system around them keeps getting thinner. A state-by-state summary of rural hospital data found 45 Oklahoma rural hospitals at risk of closing, including 18 at immediate risk. That is not a warning light. That is the dashboard on fire. Services disappear first. A hospital stops delivering babies. Then chemotherapy disappears. Then specialty care moves farther away. Then the emergency room becomes the last thin line between a community and a healthcare desert. Oklahoma voters had to force Medicaid expansion through State Question 802 after years of resistance from Republican leadership. Expansion helped reduce uncompensated care and stabilize parts of a system that had been left exposed. The Congressional Budget Office estimated the Medicaid provisions in H.R. 1 would increase the number of uninsured Americans by 7.8 million. Oklahoma healthcare leaders estimated hospitals could face $6.3 billion in Medicaid reimbursement cuts over 10 years. Oklahoma secured $223.5 million for the first budget period of the Rural Health Transformation Program. That money should be used well. But Oklahoma healthcare leaders estimate hospitals could face about $630 million a year in Medicaid reimbursement cuts. And SNAP estimates show another $628 million at risk in 2029. A grant does not erase the cuts. A hospital is not just health care. It is emergency access, ambulance turnaround, local jobs, worker recruitment, and community stability. When the hospital leaves town, the loss is not only medical. It is economic. Oklahoma Republicans can keep talking about rural values. Rural Oklahoma should ask for rural results. Because a state that lets rural hospitals weaken while protecting tax cuts is not defending rural Oklahoma. It is using rural Oklahoma